Cancer is a disease that's very much linked with lifestyle. It's one of the chronic diseases like diabetes and heart disease that are actually really influenced by your lifestyle. I think a lot of people out there think it's your family history that has the biggest impact on whether you get cancer or not, but it's a lot of things that are actually within your control. So the most important risk factors for cancer are being a smoker. That's a really strong risk factor for a whole range of different cancers. Being out in the sun is a risk factor for skin cancer and melanoma. The other risk factors that people aren't so aware of as well is being overweight or obese is a risk factor for bowel cancer and for breast cancer. And also a lack of physical activity is also a risk factor for those cancers as well. And we also know that having things like fruits and vegetables can also help to protect you against cancer as well. To avoid cancer, the most important thing they can do is, if they're a smoker, give up smoking, but better still don't take up the habit in the first place. The other thing that's really important is to maintain a healthy body weight, so that means being active on a regular basis, so aiming for about 30 minutes of physical activity each day, and also having a healthy diet. And the most important aspect of a healthy diet in terms of cancer is going for 2 serves of fruit and 5 serves of vegetables each day. Okay, I think that's the real challenge that we have when we work in cancer control, is getting people to realise what you're doing today can affect your chance of getting such a serious disease as cancer. So yes, you're right, most people who are diagnosed with cancer, tend to be 50 and older, but it's really important what you're doing now impacts on your risk. And if you're taking up a lot of unhealthy habits, so say for example smoking when you're younger, it's going to be that much harder to give up when you get to your 50s or 60s and you're not breathing so well. So what you're doing now is really important for setting you up for a good future. So it's really important that you give up smoking if you're a smoker, but don't take it up is even better. Be as physically active as you can. That's going to help protect you against cancer, plus a whole range of other diseases, and also follow a healthy diet as well. So, and again, fruits and vegetables are really important there. It's also important to think about sun protection as well. So being out in the sun too much can be a risk factor for cancer, so it's important to remember the slip, slop, sack message. Slip on a hat, slop on some sunscreen, and make sure you keep your skin fairly covered as well. Okay, well, the Cancer Council is a community-based organisation. We rely on all our funding to come from the generosity of people in the community. We don't really receive a lot of government funding. And what our priority areas at the Cancer Council is about supporting people who are diagnosed with cancer and making sure that they have the right sorts of information and support as they're diagnosed with cancer. And we have something called a Cancer Council helpline that anybody can ring up and have their questions answered. But also at the Cancer Council, we're very aware of the need to prevent cancer, and as I've mentioned, a lot of the risk factors for cancer are very preventable. So we work on a lot of programs about cancer prevention. So we look at things like tobacco issues and try and make the environment an environment where it's harder to take up smoking. So things like smoke-free pubs and clubs are one of the programs we've been working on there. We also look at the importance of people having a healthy weight, so we try and look at programs that encourage healthy eating. So we are working on a program where we're trying to get parents to eat more fruits and vegetables, and hopefully that will also lead to their children eating more fruits and vegetables. And we're also involved in programs like about sun protection as well. So we have Sun Smart Childcare Centre programs and things that we do with schools that way. So as well as trying to support people once they're diagnosed with cancer, we also try and look at the things that we can do to make the community a cancer smart community, so less risk of getting cancer, because that's going to be the best way rather than supporting them afterwards. And we also fund a lot of research as well. That's the other thing that the Cancer Council is well known for. We fund research that we do here in the Cancer Council, and we also fund a whole lot of different researchers that are attached to universities around New South Wales as well.